I can't believe I'm going to sleep in there again in that lazy boy with my son, who now has had no help at all. And he needs it.
Earlier this month, we brought you Jay Gross's story, how his son spent 12 days in the hospital and what his family went through trying to get their son in inpatient psychiatric care. His emotional video went viral with over 100,000 views on YouTube. But Gross's family isn't the only one experiencing this problem, so we started to ask questions.
This is about changing the systemic structure of how behavioral health care is delivered.
Inpatient psychiatric access has been a challenge in Michigan for decades. According to a 2018 work group report by a group called the Michigan Inpatient Psychiatric Admission Discussion, or MyPAD, there were 729 inpatient psychiatric beds for children and teens in community hospitals in 1993. But by 2017, that number had decreased to 276. Right now, Michigan has a total of 389 inpatient psychiatric beds for children and teens. But currently, Michigan health officials tell us all of those beds are full, meaning families like the Grosses sit and wait for resources to become available.
I mean, we got all kinds of people. They're doing everything they can for us, but the powers that be in this system, the system of mental health, is so broken.
So why is Michigan in such a bad spot?
There has been a reduction over time in the number of available beds. So anytime that you restrict the number that are available, it gets harder to get those beds.
Like any crisis response system, which is what psychiatric inpatient is, at times you have open beds and at times there aren't any. They also aren't equally distributed.
Harmony Gould is the Vice President of Hospital and Residential Services at Pine Rest Christian Mental Health Services in West Michigan, the fourth largest behavioral health hospital in the U.S. And Bob Sheehan is the Chief Executive Officer for the Community Mental Health Association of Michigan. They say the state needs more money, more psychiatrists, and more psychiatric nurses to broaden the inpatient treatment options for kids and teens.
Usually you aren't going to find a psychiatric bed for your son or daughter in your local hospital. But with the right kind of physical plan and the right kind of financing for that and the right kind of financing for staff training, a number of local community-based hospitals would like to open psychiatric beds for kids and adults.
We also need enough nurses and psychiatrists and psychiatric technicians to work in these places. This is really draining work.
And the coronavirus pandemic, recent racial and social justice issues, and the political climate have only made matters worse when it comes to mental health.
So there was already a bed access problem, an inpatient psychiatric bed access problem before the pandemic. You have fear of a contagious illness. You have the isolation of the pandemic, or the lack of isolation if you were used to being sort of living without everyone living or going to school and working all in the same home. Economic loss, 40% of Michigan families with kids lost pay during that period, and they're still losing it.
Certainly, we are living in really complicated times, and children and adolescents are trying to make sense of them, whether it's pressures from social media, what they're seeing on TV, or maybe experiencing in their own communities. There's a tremendous amount of stress.
That stress is being felt all across the country. So I wanted to know, when it comes to mental health resources, how does Michigan compare to other states? Ohio has 186 private psychiatric hospital beds for adolescents and 52 for children. That's one bed for every 49,000 residents. Washington State has only 84 publicly funded psychiatric beds, according to Crosscut. One bed for every 91,000 residents. In Massachusetts, 340 of the state's psychiatric beds are available for those under the age of 18, according to STAT. One bed for every 20,000 residents. By these calculations, Michigan has one bed for every 26,000 residents, which comparatively is better than most of those states. But it is more complicated than that. The number of beds paint an incomplete picture because there are a whole host of alternative treatment and care solutions that states can use. And Sheehan says that is where Michigan needs to improve.
People will often ask us in the state, where do we stack up relative to the number of beds per capita in Michigan? We're at the lower end. However, you don't want to be at the higher end. Let me just give you an example of that. For decades, and Michigan was way ahead of the curve. We had beds that we used as the main form of treatment for mental health, and that's not the best approach. You want to be someplace at the lower end for sure, because you want to have a bunch of alternatives. There's no magic to figuring that sweet spot out, but it's a sweet spot of the number of beds and the number of community alternatives to inpatient, but also geographically spread.
Those alternatives are in the works, but they cost money, and the right people need to be in place in order to implement them.
Bring CSUs, crisis stabilization units, online, bring psychiatric residential treatment facilities online, continue all the home-based work, and bring distributed inpatient psychiatric beds, and you'd have an ideal system.
Of course, it isn't that easy. In part 2 of this conversation, we'll take a deeper look at the Michigan Inpatient Psychiatric Admission Discussion Report and some of the changes that are in the works right now, plus some of the systemic issues that are holding us back. But Sheehan and Gould say one thing people can do right now is continue to advocate for their loved ones.
So is there anything you want to say to families out there who might be in the same situation as Jake Gross, and they just feel like, nobody's doing anything, nothing's coming, like, help us? Do you just want to say anything to them to let them know that, like, you guys have solutions?
Yeah, actually, I do want to say some things to families like the Gross family. Continue to be a champion for your loved one. What I mean by that is stay with them, stay alongside them, be their companion in this walk. Don't give up.
And I think the work that the Gross family, for example, has done to get their voice heard, people are noticing and paying attention. And more families have to tell that story, because often it's invisible. If you don't have firsthand experience with it, you might not realize how complicated it is to access the services that you or your family needs. And so keep talking about it.
Reporting for Fox 47 News, I'm Tiana Jenkins.